The City University of New York is a really important asset for improving health and improving food here in New York City. There are thousands of CUNY students and hundreds of CUNY faculty and staff throughout our system who are committed to food justice, food policy, food equity. Food is really at the intersection of health, community development, sustainability, the larger climate environment, workforce development. We found that food is a lens through which we can look at the opportunities for improving well-being in urban communities.
It's important that our institute is housed here within the CUNY Graduate School of Public Health and Health Policy here in Harlem is because Harlem really is a microcosm of what's happening in New York. There's lots of changes to the neighborhood, newer residents coming in, existing residents having a tougher time staying in the neighborhood, and the sorts of food that's available both in the retail environment with respect to corner stores, supermarkets, bodegas, but also the sorts of restaurants that are coming in. We really don't know what sort of impact it's going to have for the existing residents, and our work really looks at those urban food problems and the way in which we try to address the shortcomings of our current food system.
The CUNY School of Public Health received a 3-year grant from the National Science Foundation to study urban agriculture in New York City, but also with colleagues of mine in Germany, France, Poland, and the UK. This international study is really trying to understand the effects of urban agriculture and what it would mean to scale up urban agriculture in cities like New York. Harlem Grown is an amazing organization in central Harlem that operates community gardens throughout the neighborhood. And these gardens, like most urban agriculture projects, are not about the quantity of food grown, but they're spaces and activities to really help the community become more resilient. They're places where kids can learn about science and food and nutrition. They're places where people can come together and work together. And so these are really important assets for the neighborhood. Gentrification and redevelopment of a neighborhood can have different effects on the food environment. The Institute has been working with communities throughout New York City to help people become engaged and participate in planning and zoning decisions so that as their neighborhoods change, their food environments can remain intact. We've been researching innovations in food access. A new evaluation of a company called Lemon Tree that sells meal kits at very low cost, $2 per serving, to low-income residents of public housing. And a second project involves organizing residents of a public housing development to shop online and organize themselves to buy more cost-effectively and conveniently.
One of our projects that closely relates to addressing food inequities is our research looking at the way in which the ability of immigrants to be able to access food assistance programs have changed since the 2016 election. We've talked to over 24 organizations here in New York that serve both immigrant populations, but that also have a focus on food insecurity. And what we found is that there's a profound fear among the populations that they serve, and that even in cases where resources are free and clear, that is, there are no strings attached, there are no identification mandates, there's still a reticence to access those programs because of the political climate that we're in. And we wanted to figure out what are the sorts of things that states, city governments, county governments can do in order to fill that gap that's emerging.
Our institute completed a study looking at 10 years of food policy here in New York City. Food is much higher on this city's policy agenda now than it was 10 or 15 years ago, and we think that's a positive development. And we also identified really dozens and dozens of policies that have looked to address nutrition, food insecurity, creating better food jobs. But when we looked at the most basic outcomes, we found that not so much had changed in the last 10 years. We proposed that New York City develop a food plan with clearly identified, measurable targets for reducing food insecurity, for improving access to fruits and vegetables, and then to monitor success in achieving those objectives. And we're pleased that the City Council is now considering legislation to establish just such a food plan.
Research has shown that communities of color, lower income communities experience more unhealthy marketing compared to higher income and white communities. We started a program called the Youth Food Educators Program. With that program, we recruit young people from the community, from East Harlem, from South Bronx, from other areas across New York City that are low income communities, and we train them over 6 weeks to develop their own counter-marketing campaigns against unhealthy foods. And we also train them to be public health advocates in their communities, advocating for healthier marketing. They also go out and give community presentations and raise awareness about the unhealthy and subtle marketing strategies that big food companies use to persuade, especially communities of color, to purchase unhealthy junk food.
My name is Renee Cox, and I participated in the Food Security Advocates Program developed by the CUNY Urban Food Policy Institute. This training was vital in teaching me the language to speak about food insecurity. It also taught me the strategies to connect with fellow students, to be able to help them, and it helped me to understand the resources and to be able to articulate those resources to students on my campus.
At the CUNY Urban Food Policy Institute, we hope to advance our school's mission of preparing the public health professionals who can solve the problems facing the world's cities. People who have interdisciplinary expertise, who can communicate effectively both with community residents, policymakers, and elected officials. And we provide the students here at the School of Public Health with an opportunity to develop and practice those skills so that when they graduate, they can go out and make a difference.